2020 coronavirus outbreak in Italy. The 2019-20 coronavirus outbreak was confirmed to have spread to Italy on January 31, 2020, when 2 Chinese tourists tested positive for SARS-CoV-2 in Rome. A cluster of COVID-19 cases was later detected, starting with 16 confirmed cases in Lombardy on 21 February, an additional 60 cases on 22 February, and Italy's first deaths reported on the same day. As of February 26, 2020, there were 12 deaths and 470 confirmed cases in Italy. Italy has the third highest infection count and the joint third highest death count for a country. Many municipalities in northern Italy have been placed under quarantine. As of late February, Italy was hit harder than anywhere else in the EU by the COVID-19 outbreak. However, Italy was one of only 2 countries in Europe to suspend all direct flight to and from China and the earliest to do so, treating the outbreak with one of the toughest measures in the EU, adding on to the confusion amongst Italian politicians and experts. History. First confirmed cases. In late January 2020, following the developments of the outbreak in mainland China, enhanced screening measures, including thermal cameras and medical staff, were set up at Leonardo da Vinci Fiumicino Airport and Milan Malpensa Airport. On 31 January, 2 cases were confirmed in Rome. They were 2 Chinese tourists who arrived in Milan on 23 January via Milan Malpensa Airport and traveled to Rome on a tourist bus. Italian government on the same date suspended all flights to and from China. Prime Minister Giuseppe Conte said Italy is the first EU country to take this precautionary measure. On 6 February, one of the Italians repatriated from Wuhan, China, tested positive for COVID-19, bringing the total number of cases in Italy to 3. On 22 February, the repatriated Italian recovered and was discharged from the hospital. On 22 and 26 February, the 2 Chinese tourists tested negative for COVID-19 at Lazzaro Spallanzani National Institute for Infectious Diseases in Rome. Lombardy cluster. The Lombardy outbreak came to light when a 38-year-old Italian tested positive for COVID-19 in Codogno, the province of Lodi, Lombardy. Previously, he met a friend who had returned from China on January 21, 2020. On 14 February, he felt unwell and went to a doctor in Castiglione d'Adda. He was prescribed treatments for influenza. On 16 February, as his condition worsened, he went to Codogno Hospital, reporting respiratory problems. Initially, there was no suspicion of SARS-CoV-2, so no additional precautionary measures were taken and the virus was able to infect other patients and health workers. Later, the patient, his pregnant wife and a friend tested positive. However, the friend from China whom he met tested negative. 3 more cases were confirmed on the same day after the patients reported symptoms of pneumonia. Thereafter, extensive screenings and checks were performed on everyone that had possibly been in contact or near the infected subjects. He was asymptomatic for weeks and reportedly led an active social life, potentially interacted with dozens of people before spreading the virus at Codogno Hospital. Afterwards, he was transferred to Policlinico San Matteo in Pavia, and his wife to Sacco Hospital in Milan. On 21 February, 16 more cases were confirmed, 14 in Lombardy, including the doctor who prescribed the treatments to the 38-year-old Codogno man, and 2 in Veneto. On 22 February, a 77-year-old woman from Castel Pusterlengo, who suffered from pneumonia and visited the same emergency room as the 38-year-old from Codogno, died in Lombardy. Including the 78-year-old man who died in Veneto, the number of cases in Italy rose to 79. Of the 76 newly discovered cases, 54 were found in Lombardy, including 1 patient in San Raffaele Hospital in Milan and 8 patients in Policlinico San Matteo in Pavia, 17 in Veneto, 2 in Emilia-Romagna, 2 in Lazio and 1 in Piedmont. On 23 February, a 68-year-old woman with cancer from Trescore Cremasco died in Crema. The number of cases in Italy rose to 152, including 14 patients being treated at Policlinico San Matteo in Pavia. On 24 February, an 84-year-old man with pre-existing medical conditions from Villa di Serio died in Bergamo while hospitalized in the Papa Giovanni XXIII hospital. An 88-year-old man from Casellandi who resided in Codogno died on the same day. An 80-year-old man from Castiglione d'Adda died at the Luigi Sacco Hospital in Milan. He was previously hospitalized at Lodi due to a heart attack, and then transferred to Milan when confirmed positive for COVID-19. A 62-year-old man with pre-existing medical conditions from Castiglione d'Adda died in Sant'Anna Hospital in Como. Lombardy Governor Attilio Fontana announced that the number of cases in Lombardy had risen to 172, with a total of 229 confirmed in Italy. On 25 February, an 84-year-old man from Nembro, a 91-year-old man from San Fiorano and an 83-year-old woman from Codogno died due to complications from the infections. The number of cases in Emilia-Romagna rose to 23, spreading through the provinces of Piacenza, Parma, Modena, and Rimini. These were all linked to the Lombardy cluster. A new case linked to the outbreak in Lombardy appeared in Palermo, Sicily. A 60-year-old woman from Bergamo tested positive and was admitted to Cervello Hospital. A 49-year-old man who previously visited Codogno tested positive in Pescia, Tuscany. Liguria confirmed that a 72-year-old female tourist from Castiglione d'Adda tested positive in Alassio while she was staying in a hotel. The woman was treated at a hospital in Genoa. Later in the day, a second case in Liguria was confirmed. A 54-year-old man who visited Codogno for work tested positive in La Spezia. The number of cases in Lombardy rose to 240, with a total of 325 in Italy. On 26 February, a 69-year-old man from Lodi with pre-existing medical conditions died in Emilia-Romagna. Additional cases involving 6 minors were identified in Lombardy. A 4-year-old girl from Castiglione d'Adda was admitted to Policlinico San Matteo in Pavia. A 15-year-old was hospitalized in Siriate Hospital in Bergamo. 2 10-year-olds from Cremona and Lodi were tested positive and discharged. A 17-year-old from Valtellina, who attended a school in Codogno, and a school friend from Sondrio, also tested positive. Apulia confirmed that a 33-year-old man from Taranto, who returned from Codogno on 23 January, tested positive and was admitted to San Giuseppe Mascati Hospital. A close advisor of Lombardy Governor Attilio Fontana tested positive for SARS-CoV-2. Although Fontana tested negative, he decided to put himself in preventive isolation as well. Campania confirmed 2 new COVID-19 cases. A 24-year-old woman from Caserta, who previously visited Milan, tested positive. A 25-year-old Ukrainian woman from Cremona, who previously visited Lombardy, arrived at the emergency room at a hospital in Vallo della Lucania and tested positive. Both were transferred to Hospital Domenico Cotugno in Naples, where they underwent isolation. The number of cases in Lombardy rose to 305, with a total of 455 in Italy. Veneto cluster. A secondary cluster of infections occurred in the region of Veneto, initially thought to be the result of a farmer being infected when visiting the primary source in Codogno. The farmer was tested and the following day, the test was confirmed negative. On February 21, 2020, 2 people tested positive in Veneto. The next day, one of them, a 78-year-old man, died in the Schiavonia Hospital in Padua, making him the first fatality in Italy. The man lived in the municipality of Bo, which was put under quarantine. On 25 February, a 76-year-old woman with pre-existing medical conditions died in Treviso. On 26 February, an additional case involving a minor was identified. An 8-year-old girl, who lived in Cadavigo, tested positive. As of 26 February, there were 87 confirmed cases in Veneto, with 42 cases in the municipality of Bo, including the 2 fatalities. The other cases included 5 in Dolo, 8 in Venice, 1 in Chioggia, 8 in Lamegna, 14 in Treviso, and 9 in unidentified areas within Veneto. Other regions. A number of COVID-19 cases have emerged in multiple regions that might be isolated and not associated with the northern Italy clusters. On February 25, 2020, the first case in Florence, Tuscany involved a 63-year-old entrepreneur with companies in Asia, who returned from Singapore in early January. He tested positive for SARS-CoV-2 and was admitted to Santa Maria Annunziata Hospital. The first case in Rimini involved a 71-year-old man from Cattolica, who returned from Romania on 22 February. He tested positive and was admitted to Infermi Hospital. A 51-year-old man from Pian di Meleto, who went to Romania with him, also tested positive and underwent self-quarantine at home. On 26 February, one of people with whom he interacted in Romania tested positive. On 26 February, The Norwegian Institute of Public Health confirmed that a 26-year-old Norwegian man living in Florence tested positive and was admitted to Santa Maria Annunziata Hospital. He had stayed in Norway for 14 days and returned to Florence the previous week. Spread to other countries. A number of COVID-19 cases have emerged worldwide that appear to have been the result of infections associated with the northern Italy clusters. As of 26 February, 14 countries have recorded cases which appear to have originated from Italy. On 25 February, Algeria confirmed the first case of COVID-19, an Italian man from Berdonico, Lombardy, who arrived in the country on 17 February, tested positive for SARS-CoV-2. On 25 February, Austria confirmed the first 2 cases of COVID-19, a 24-year-old man and a 24-year-old woman from Lombardy, who visited their hometown in Bergamo, tested positive for SARS-CoV-2 and were treated at a hospital in Innsbruck, Tyrol. On 25 February, Brazil confirmed the first case of COVID-19, a 61-year-old man from São Paulo, who traveled to Lombardy between 9 and 21 February, tested positive for SARS-CoV-2. He was showing mild symptoms and quarantined at home. On 25 February, Croatia confirmed the first case of COVID-19, a 26-year-old man, who previously stayed in Milan between 19 to 21 February, tested positive for SARS-CoV-2 and was hospitalized in University Hospital for Infectious Diseases Dr. Fran Mihajovic in Zagreb. On 26 February, his twin brother tested positive and was admitted University Hospital for Infectious Diseases Drive. Fran Mihajovic, a Croatian man who worked in Parma, Italy, also tested positive and admitted at a hospital in Rijeka. On 27 February, Denmark confirmed the first case of COVID-19, a man, who returned home from a ski holiday in Valmalenko, Sondrio, tested positive for SARS-CoV-2. On 25 February, France confirmed that a French national, who recently returned from a trip in Lombardy, tested positive for SARS-CoV-2 and was treated in a hospital in Auvergne-Rhône-Alpes. On 26 February, a 36-year-old man, who made multiple trips to Lombardy, tested positive and was treated in Neuville Hospital Civil, Strasbourg. On 26 February, Finland confirmed that a Finnish woman, who made a trip to Milan and was back in Finland on 22 February, tested positive for SARS-CoV-2 at the Helsinki University Central Hospital. On 25 February, Germany confirmed that a 25-year-old man from Göppingen, Baden-Württemberg, who recently returned from Milan, tested positive for SARS-CoV-2 and was treated in Klinik am Eickert, Göppingen. On 26 February, the 24-year-old girlfriend of the 25-year-old man from Göppingen and her 60-year-old father, who worked as a chief physician at University Hospital Tübingen, tested positive and were admitted to the same hospital at Tübingen. A 32-year-old man from Rothweil, Baden-Württemberg, who visited Codogno with his family on 23 February, tested positive and was admitted to a hospital for isolation. On 26 February, Greece confirmed the first case of COVID-19, a 38-year-old woman from Thessaloniki, who recently visited northern Italy, tested positive for SARS-CoV-2 and was admitted to a HEPA University hospital. On 26 February, North Macedonia confirmed the first case of COVID-19, a woman tested positive for SARS-CoV-2 in Clinic for Infectious Diseases, Skopje. She stayed in Italy for a month and had been sick for 2 weeks. Upon returning to North Macedonia, she immediately reported to the clinic. On 26 February, Romania confirmed the first case of COVID-19, a man from Gorj tested positive for SARS-CoV-2, after coming in contact with an 71-year-old Italian man from Cattolica, Italy. The Italian man visited his wife's family and had several business meetings in Romania on 18 to 22 February. The Romanian man was admitted to National Institute of Infectious Diseases Professor Dr. Matei Bals in Bucharest. On February 24, 2020, a 69-year-old medical doctor from Lombardy, who was vacationing in Tenerife since 17 February, tested positive for SARS-CoV-2 at the University Hospital of the Nuestra Señora de Candelaria in Spain. A 25-year-old man coming back from a holiday in Italy also tested positive in Asturias, Spain. On 25 February, the wife of the medical doctor from Lombardy, who was vacationing in Tenerife, tested positive and was admitted to the same hospital as her husband. A 36-year-old Italian woman living in Barcelona, who visited Bergamo and Milan from 12 to 22 February, also tested positive in Barcelona. A man from Villarreal, who recently traveled to Milan, tested positive and was admitted to Hospital Universitario de La Plana. A 24-year-old man from Madrid, who recently returned from northern Italy, tested positive and was admitted to Hospital Carlos III. On 26 February, 2 Italian tourists, who were vacationing together with a Lombardy doctor and his wife, also tested positive. The group were transferred to University Hospital of the Nuestra Señora de Candelaria and underwent quarantine. A 22-year-old man from Barcelona, who traveled to Milan between 22 and 25 February, tested positive and was admitted to hospital clinic. A woman from La Gomera, who traveled to Italy between 4 to 8 February, tested positive and was admitted to Hospital General de La Gomera in Tenerife. On 26 February, Sweden confirmed that a 30-year-old man, who previously visited northern Italy, fell ill 3 days after returning to Sweden. He tested positive for SARS-CoV-2 and was admitted to Sahlgrenska University Hospital in Gothenburg. On 25 February, Switzerland confirmed the first case of COVID-19, a 70-year-old man in Italian-speaking Canton Ticino, who previously visited Milan. Timeline. Reactions. On January 31, 2020, the Italian Council of Ministers appointed Angelo Borelli, head of the Civil Protection, as Special Commissioner for the COVID-19 emergency. On 22 February, the government announced a new decree imposing the quarantine of more than 50,000 people from 11 different municipalities in northern Italy. The quarantine zones were called the red zones and the areas in Lombardy and Veneto outside of them were called the yellow zones. Penalties for violations ranged from a €206 fine to 3 months of imprisonment. The Italian military and law enforcement agencies were instructed to secure and implement the lockdown. Schools were closed in 10 municipalities in Lombardy, 1 in Veneto and 1 in Emilia-Romagna. All public events were cancelled and some commercial activities were halted or were allowed to resume only until 6 p.m. All religious services were cancelled. Regional train services to the most affected areas were suspended, with trains skipping stops at Codogno, Malio and Castel Pusterlengo stations. People with symptoms were advised to call the emergency number 112 instead of going directly to hospitals to limit the disease's spread. The Ministry of Health provided a website and a direct line, 1500, where people could obtain the latest updates and information, as well as report suspected cases. Educational trips to destinations in Italy and abroad were suspended. Universities in Lombardy, Veneto, Piedmont and Emilia-Romagna suspended all activities from 23 February until 1 March. On February 22, 2020, Prime Minister of Italy, Giuseppe Conte, suspended all sporting events in the regions of Lombardy and Veneto, which included 3 Serie A football matches in those regions, as well as 1 in Piedmont, that were to be played the following day, due to the outbreak. The following week, 5 matches were played behind closed doors due to scare of the outbreak. Authorities in Veneto cancelled the last 2 days of the Carnival of Venice. Authorities in Piedmont cancelled the last 3 days of the Carnival of Ivrea. La Scala, Duomo di Milano, and Piccolo Teatro in Milan, as well as Basilica di San Marco in Venice, were closed until further notice. Giorgio Armani Fashion Show, which was scheduled on Sunday, the last day of Milan Fashion Week 2020, went ahead without any media or buyers present. It was instead streamed live online. In addition to the emergency phone numbers 112 and 118, new dedicated numbers were added for the different regions: Lombardy 800,894,545, Campania 800,909,699, Veneto 800,462,340, Piedmont 800,333,444 and Emilia-Romagna 800,033,033. The Ocean Viking, a rescue ship operated by MSF and SOS Mediterranee that was carrying almost 300 migrants, was quarantined for 14 days in Pozzallo, Sicily. Trenitalia and Italo, the major providers for Italy's high-speed trains, ordered the installation of hand sanitizer dispensers on all trains as well as the distribution of masks, disposable gloves and disinfectants to all onboard staffs. Supermarkets in Lombardy and Emilia-Romagna were emptied by customers, as residents stockpiled food and supplies. Streets, parks and train stations in multiple cities in Lombardy were left deserted. On 24 February, 500 additional police officers were assigned to patrol the quarantined areas in Lodi and Veneto. Additional toll-free numbers were added for other regions: Valle d'Aosta 800,122,121, Trentino Alto Adige 800,751,751, Friuli Venezia Giulia 800,500,300, Toscana 800,556,060, Umbria 800,636,363, Marche 800,936,677 and Lazio 800,118,800. The governor of Basilicata, Vito Bardi, instituted a mandatory 14-day quarantine for people arriving from areas in northern Italy affected by the outbreak. The Ministry of Health announced that it had engaged 31 laboratories in Italy to carry out the analysis of swabs from suspected COVID-19 cases. Minister Roberto Speranza appointed Walter Ricciardi, a member of World Health Organization's Executive Committee and former president of Italian National Institute of Health, as a special advisor for relations between Italy and international health organizations. Filming of Mission Impossible 7 starring Tom Cruise in Venice was halted. Major companies such as IBM, Enel, Luxottica, PwC and Vodafone continued to allow employees to work from home. Generali Tower in Milan and Palazzo Madama in Rome installed thermal scanners to measure temperatures of visitors and employees. FAO headquarters in Rome conducted temperature checks on visitors entering the building. Multiple regions in Italy such as Liguria, Trentino Alto Adige, Friuli Venezia Giulia, Abruzzo and Marche decided to close all schools and universities for 2 days to a week. Court proceedings were postponed until further notice. The FTSE MIB index fell by 6% and other stock market indices across Europe were also affected. Over 300,000 calls per day were logged on Lombardy's toll-free line as well as the emergency number 112. Some of the residents inside the red zone managed to leave the quarantined areas daily, bypassing the checkpoints by going through the back roads. On 25 February, USAF Aviano Air Base decided to close all schools until 28 February. General Todd D. Walters issued a travel ban to the areas of Italy affected by the outbreak for U.S. service members and their families. Driver's license exams were suspended in Lombardy and Veneto. The number of checkpoints in the red zones was increased from 15 to 35, and Army personnel was sent to help staff these checkpoints. The Italian Basketball Federation suspended all the championship games, including Lega Basket Serie A. Istituto Tecnico Economico Enrico Tosi in Varese, Istituto Comprensivo di Pianoro in Bologna, and Liceo Attilio Bertolucci in Parma conducted lessons for students online while waiting for the schools to reopen. The University of Palermo suspended all activities until 9 March. Morgan Stanley, Barclays, Mediobanca and UniCredit requested their Milan staff to work from home. Multiple fairs and exhibitions were rescheduled. Salone del Mobile, a furniture fair in Milan, was postponed to 16 to 21 June. Bologna Children's Book Fair was rescheduled to 4 to 7 May. Cosmoprof Worldwide Bologna, a cosmetic fair, was rescheduled to 11 to 15 June. Expicasa, a furniture fair in Turin, was rescheduled to 28 March to 5 April. Roma Moda Days was postponed to 17 to 19 April. Italy opened a probe on skyrocketing online prices for masks and sanitizing gels. Police issued warnings that criminals were using false identities and posed as health inspectors to gain access to people's homes to steal money, jewelry and other valuables. On 26 February, the director of Higher Health Council, Franco Locatelli, announced that swabbing would only be performed on symptomatic patients, as out of all the swabs previously tested, 95% were negative. Palermo and Naples decided to close all schools until 29 February. The University of Basilicata installed a thermal scanner and continued all teaching activities as per normal. The University of Bari suspended all medical and health-related internships for medical and healthcare students. Politecnico di Milano conducted thesis mentoring for more than 1,000 students graduating the following week using Skype. The Italian Winter Sports Federation decided to proceed with the Women's World Cup alpine skiing races at Lothal, Aosta Valley on 30 February. Mito Milan Eyewear Show was rescheduled to 5 to 7 July. Reactions abroad. On February 23, 2020, Austria suspended all trains to and from Italy for a couple of hours due to suspected cases. Romania instituted quarantine for people arriving from Lombardy and Veneto. On 24 February, an Alitalia flight from Rome to Mauritius was blocked at the Sir Ramgoolam International Airport by the local authorities, who imposed quarantine or repatriation for 212 Italian passengers. 172 passengers were allowed to disembark while 40 passengers from Lombardy and Veneto decided to go back to Italy due to the quarantine rule imposed by the Mauritius government. An intercity bus operated by Flixbus from Milan to Lyon was quarantined at Gare de Lyon Peric station so the passengers could undergo health checks. Brazil added Italy to its COVID-19 alert list. Passengers entering Brazil from Italy showing flu symptoms would undergo medical checkups. Argentina, France, Croatia, Egypt, Greece, Ireland, Israel, Latvia, Lithuania, Ukraine, Serbia, and South Africa issued multiple recommendations which included postponement of school trips to Italy, a 14-day quarantine for people arriving from Lombardy and Veneto and for all citizens not to travel to regions of Italy affected by the outbreak. A joint WHO and ECDC mission arrived in Italy to support COVID-19 control and prevention efforts. The European Parliament's Director General for Personnel, Christian Knudsen, requested staff who had traveled to areas affected by COVID-19 outbreak including parts of Italy, China, Singapore or South Korea to self-quarantine and work from home for 14 days. The Dow Jones Industrial Average plunged more than 1,000 points, the worst single-day drop in more than 2 years. The S&P and Nasdaq indices also tumbled by more than 3.3% and 3.7% respectively. On 25 February, the United Kingdom and Malta recommended travelers coming from Italy to self-quarantine for 14 days and for all citizens not to travel to regions of Italy affected by the outbreak. Malta installed thermal scanning devices to monitor passengers arriving via Malta International Airport, as well as passengers disembarking from vessels at the Grand Harbour and the Virtu Ferries catamaran terminal in Marsa, which had direct connections to Pozzallo and Catania in Sicily. Prague International Airport introduced special arrival gates for selective screening of passengers arriving on flights from Italy. Kuwait, Iraq, Jordan and Seychelles suspended all flights to and from Italy. Bulgaria suspended all flights to and from Milan until 27 March. Australia, Saudi Arabia, Netherlands and the United States issued a travel advisory for all citizens not to travel to parts of Italy affected by the outbreak. 2 intercity buses operated by Flixbus, one traveling from Lyon to Rijeka via Turin, the other traveling from Turin to Zagreb, were stopped at the Croatian borders for a couple of hours as the passengers underwent health checks. Goldman Sachs, Deloitte, Citigroup Incorporated, Credit Suisse, Lazard, Crédit Agricole, Nomura, Banque Populaire and BNP Paribas requested staff who recently returned from Italy to work from home for at least 14 days as well as deferred non-essential travels to Italy. On 26 February, the European Parliament postponed internships for 35 trainees who declared residence addresses in areas affected by COVID-19 outbreak including Lombardy, Piedmont, Emilia-Romagna and Veneto. For these trainees, the internships were postponed to 1 October. 6 American universities, Elon University, Fairfield University, Florida International University, New York University, Stanford University and Syracuse University, postponed or canceled their study abroad programs in Italy, mainly in Florence. Russia, Spain and Turkey issued a recommendation for all citizens not to travel to regions of Italy affected by the outbreak. El Salvador barred the entry of travelers arriving from Italy. The MSC Meraviglia operated by MSC Cruises was denied permission to dock at Ochos Rios in Jamaica, Georgetown in Cayman Islands and Cozumel in Mexico. The cruise liner was carrying 4,500 passengers and 1,600 crew members, one of them was reportedly showing flu symptoms. The chief executive of the Irish Rugby Football Union, IRFU, Philip Brown, cancelled Six Nations Championship rugby matches between Ireland and Italy on 6 to 8 March in Dublin. Between Ireland and Italy on 6 to 8 March in Dublin. Between Ireland and Italy on 6 to 8 March in Dublin. Between Ireland and Italy on 6 to 8 March in